Good morning. Thank you for joining us this morning. I'm Jeff Lax, the President and Chief Executive Officer of Hartford HealthCare, and it's a great honor to be back here today. A week later, really making history for the second time in 2 weeks. Last week I described that historic moment when we administered our first vaccine, the Pfizer vaccine, that it was the dawn of a new day. Today, being the first in our state to deliver the Moderna vaccine, this is a shot for hope. This is truly a shot for hope. We have such renewed hope. This is a step closer, and an important step closer for us. Today we're going to have momentarily 20 additional pioneers from across our health system working at all levels of our organization, volunteering, coming forward to demonstrate and role model to our community about the safety, the efficacy, and their personal commitment to bringing this vaccine forward within our community. I can't express enough gratitude for our staff. The way they're stepping forward, all of my colleagues, their willingness to do whatever it takes under all circumstances throughout this crisis, and again in this moment, it's difficult to even put words to describe it. This vaccine today, the Moderna vaccine, comes to us with perfect timing. Getting 9,000 additional vaccines here today. We've now delivered already 1,000 vaccines across Hartford HealthCare. By the end of today, we will have fully utilized all of the Pfizer vaccine that was brought to us, and we are now beginning to use the Moderna vaccine. We will administer this week 10,000 vaccines, and our health system is building itself to deliver a high volume of vaccines, not only across our health system for all of our frontline healthcare workers, but in fact, we're building ourselves and pivoting to be ready to do this for our community en masse. We have clinics that are operational at each one of our hospitals. We also have 2 clinics within the Hartford HealthCare Medical Group, one in Shelton down in Fairfield County, and one here in the greater Hartford region in Wethersfield. And next week on the 28th, we will be opening up a vaccine clinic in the convention center, which we're very proud of. We have a plan in place. As we get more vaccine, we're going to build more community access points, and we're working closely in collaboration with the Department of Public Health as we move from 1A into additional groups who become eligible, so that we, within our state, use all of our resources, all of our capabilities to get this vaccine to as many people as safely and as quickly as we possibly can. So today, we're going to bring forth in a moment Keith Grant, who's our Director of Infectious Diseases across Hartford HealthCare. And Keith, he's going to be doing something really unique, and to me, it's really remarkable. But last week, as really effectively amongst the very first 2 people to get the vaccine for Pfizer, today Keith will be administering the vaccine to a nurse, Mandy Delgado. And Mandy comes to us, and she's like so many people who are just heroes. Mandy works on 11th Step Down here on the Hartford Hospital campus, and in the early days of COVID in the spring, that 11th Step Down became a COVID critical care unit. And Mandy, who's been with us for 16 years, went from working in her more conventional capacity, caring for critical care patients across a variety of spectrums, to becoming a focused expert on caring for people with COVID-19 who are under tremendous distress. And Mandy will be a great role model for our community, who has lived on the very front lines of this crisis to receive that vaccine. Mandy, we couldn't be more grateful for everything you've done and for what you're going to do today. And you will be getting the first Moderna vaccine for us, and it's so befitting for you to do that, and to have Keith Grant administer it makes so much good sense for us, the role Keith has played as a leader within our organization in this crisis. So if I could, let me invite our Director of Infectious Disease, Keith Grant, to please come forward.
All right, morning guys. So, I'll start by answering the question that everyone has asked me over the last few days. How are you feeling? So I'm doing good. It's been 7 days. If you look at the safety profile of the Pfizer vaccine and now the Moderna vaccine, the only primary symptoms that I did have is some pain at the site, which you expect from after getting an injection. So I'm doing perfectly fine. So all my friends who are waiting to see what happens to me, I'm doing great. So, obviously we've now added or expanded our capacity and our capability to vaccine many more healthcare colleagues such as Mandy. This has been a very challenging time for every member of our healthcare community, not just Hartford HealthCare, but across the nation. Over the last, I'd say, 3 weeks, we've had a significant amount of information and resources in the form of this vaccine. But I will stress, within the next few days, we will have opportunities to meet with our families and opportunities that we as individuals should assess very carefully. The key things that we've used in order to get to some level of stability, in order to protect each other, keep doing them. So our social and physical distancing, ensuring you're wearing a mask around individuals, and if you do have symptoms, please stay away from your families this season. Please get tested. Testing is readily available across the state. And keep informed with the vaccine. We can continue working with our media team to send information out. So please look out for those, right? There's going to come a time very soon where the allocation of vaccine will also be shifting into the general public. And at that point, make sure you're informed enough to make a concerted decision to take this vaccine. This is a huge step for us to move back into what is normal and appreciate our families much more. I look forward to having more positive meetings such as this, but at this time, key things, I'm doing great, and I'm looking forward to administering the first vaccine. So.
Thank you, Keith. One of the important aspects to deliver the vaccine so broadly across Connecticut is leveraging the strength of the Hartford HealthCare Pharmacy Division, which supports more than 450 Hartford HealthCare locations across Connecticut. Our Director of Pharmacy, Eric Arlia, is really driving the planning that's in place to deliver this vaccine safely and broadly across the system. And he's a true leader in the space. Eric Arlia, please.
Good morning, everybody. Another really exciting day here at Hartford Hospital, receiving the 8,800 doses of vaccine. As we're all here celebrating the first doses, members of the pharmacy team are busy breaking the order apart, and our goal is to have the Moderna vaccine at all of the acute care facilities and at Hartford HealthCare Medical Group before the end of the day today. We are excited to really accelerate all of the clinics that we've been planning. There's a tremendous amount of work going on in the background to stand these clinics up. And we've had a successful first week, and now we're ready really to increase the rate at which we're able to vaccinate our healthcare providers. Having 2 different brands of vaccine is also incredibly important. Having diversification of supply protects us all more from any issues with disruption of supply. And as we've talked about frequently, this Moderna vaccine really represents a step in the right direction towards making it more a vaccine that's easier to use in many different types of settings. This vaccine is stable in the refrigerator for 30 days. That really gives us a lot of additional options on some of the types of clinics that we can use it in. And I can anticipate us using this vaccine in many different settings as we pivot from vaccinating our healthcare providers to our patients. And I guess the last thing I wanted to say was, spent a lot of time in the clinics this week observing the work of our teams. And one thing that's really come through to me is just the tremendous level of satisfaction and pride the pharmacists and the nurses who are doing the vaccinations are feeling by being able to provide this for their colleagues. It's a feeling that we've all been waiting a long time for, and really to get to see our staff be able to help each other in that way last week was tremendously gratifying. So thank you guys all, and we'll be busy getting this vaccine out and about and ready to roll.
Thank you, Eric. We're enormously grateful for your leadership, the incredible expertise and discretionary efforts of your team. So as I spoke about, the people working on the front lines during this crisis, it's really difficult to even articulate what they've experienced and the contributions they've made for our community. Their bravery, their courage, their excellence, their commitment to patient care. We've known always how appreciative we are of their efforts, but it's never been more clear perhaps than in this moment over the last 9 months. And Mandy Delgado is an extraordinarily wonderful example of everything that we aspire for in terms of frontline healthcare workers, caregivers, and for a person who was really placed in a very unique set of circumstances that would have been impossible to plan for. So Mandy will be receiving momentarily our first Moderna vaccine, and please invite Mandy forward to say a few words. And you really are, when we call this a shot for hope, you are perhaps such a shining and extraordinary example of that. Please, Mandy.
I am happy and extremely excited to be the first one to get this Moderna vaccine. What it means to me is that maybe we can normalize ourselves again, once again. Working in the critical care, I've been exhausted, overwhelmed, seeing patients come in needing more oxygen and able to talk, and then progressively getting worse, and then actually dying, and families not being there. You know, me and my coworkers, my coworkers and I have reached out to families, FaceTime, but is that enough? In all the 16 years that I've worked, I've never thought that anything like this would happen. It does definitely take a mental toll on you. So for me, I am just excited that we have now come up with a vaccine. That means that we can move forward, and I'm sure that everybody else is also excited about this as I am. I'm confident and I'm positive that this vaccine is going to work, and that is why I am volunteering to take this vaccine first. So I wish and I hope that others will follow me in making the right move to move forward. Thank you.
We're happy to have questions for Eric, for Mandy, for Keith. Please.
Who will be available for the clinics that you outlined that you're setting up for?
So the clinics that we're planning over the next week, continuing with our healthcare providers on the front line, expanding the list to include more of those. Moving into our medical group, frontline staff in our medical group, they'll be going through the clinics at those sites, and we're also beginning to invite medical providers outside of Hartford HealthCare to those medical group practices. So it's with such an increase in the amount of vaccine supply, we're able to expand greatly the amount of people that we're able to provide it to.
And eventually the convention center will be for the general public? What is that?
It'll eventually be for the general public. At first, it'll be for more healthcare providers in our community, more private practices. That'll be the focus, and it's really following the governor's plan for how to roll the vaccine out. This is the way that we've chosen to operationalize it, taking advantages of the efficiencies of the convention center.
In terms of the convention center, how many people will you be able to see a day there, and is that going to be an everyday thing, or is it going to start next week?
We're gonna start 3 days next week, with next week being a holiday week. We're gonna use that to really work all the kinks out. So we'll have a little bit of a lower number next week, and then when we come back after New Year's Day, we'll be open 5 days a week, and we'll probably expand the number of clinic vaccine stations that we'll be running. So each station can do about 100 people in 8 hours.
I also have to ask, with the new info coming out of Europe about this new strain of COVID-19 that is officially being introduced in the United States, I mean, just a question, has anybody begun to look into it locally to see whether it can be here or where it can get here, or how it may need to be treated if and when it gets here?
Sure, I'm going to let Keith take that question.
Yeah. So, you know, still early in gathering data on that, right? But from an epidemiology perspective, obviously the state's looking at it. We're looking at it internally as well. We still believe that the vast majority of individuals who are infected and are getting infected are consistent with the strains at which this vaccine will protect us, right? going back to the vaccine clinics, obviously, it's our commitment to ensure that when this is available in supply, that we're meeting the actual demand itself. And if that means we're going to be, probably speaking, Jeff's going to, but if that means we're going to be open 7 days a week in order to facilitate that like we did with testing, I'm sure that's something we'll be able to facilitate. Like, we're very committed to ensuring that not just our healthcare providers are getting this as soon as we have it available within the system, but also everyone within the community, especially our vulnerable population. So, yeah. But more to come on that strain, definitely. There's a significant amount of conversations about it right now.
Yeah, so with that new news, nothing changes with these vaccines?
Nothing's changed at this point. That's correct. So, anything else?
Difference in dates for the second shot with this vaccine?
Yes. So Pfizer 21 days with the second shot, with Moderna is 28 days. Logistically, there's some, obviously, it's one next layer and level that Eric and his team has done really good in actually sorting out. But at this point in time, we think we're in a very good place to facilitate that. But yes, that is indeed a difference in processes, yes. Anything else? All right.